Did you know that up to 80% of people will struggle with acne at some point in their life? If you're done with dodging mirrors, skipping social events, and feeling like your acne is holding you back, then you need to watch this video. Today, I'm revealing the secrets that dermatologists use to treat acne, so you can take control of your skin and boost your confidence like never before. And trust me, you'll want to stay around until the end, where I'll give a tailored treatment for each specific type of acne. So whether you're struggling with mild comedomal acne or severe nodulocystic acne, I will give you a tailored regimen for each situation. Now get ready to transform your skincare routine and start seeing results today. My name is Dr. Asad Chaudhary and I am a medical doctor who practices dermatology. We all know that acne is like that unwanted guest that just won't leave. But to understand how to treat acne, we first have to know how it develops. Our skin has specialized oil glands that are attached to the base of our hair follicles. These oil glands secrete an oil which is called sebum, which travels up the follicles and onto the skin surface. The purpose of this sebum is to prevent our skin from drying out. These glands are mostly present on the face, chest, back, and shoulders. And you'll notice that this is the most common area where acne develops. The surface of your skin is constantly making new cells while getting rid of old dead cells. The purpose of the sebum is to wash away these dead cells. The problem occurs when there is too much oil or sebum production. When this occurs, for example during puberty, when your hormones are absolutely raging, the excess oil traps the dead skin cells and blocks the pores. This prevents the further flow of sebum and the removal of the dead cells. This leads to the formation of comedomal acne, which is also known as whiteheads and blackheads. The difference between the two is only the size of the pore opening. Blackheads have a larger opening, which is why they are also called open comedones. When the sebum is exposed to the air, the melanin in the sebum oxidizes and turns black. As a result, the blackheads appear as bumps with central black areas. Whiteheads, on the other hand, have smaller pores, so the oxygen cannot reach the sebum inside. Whiteheads are also called closed comedones and appear as small skin-colored bumps. So till now, the acne isn't too severe, but eventually the blocked follicle will create an oxygen-deficient environment which is ideal for the growth of a bacteria known as Corynebacterium acnes. Now this bacteria is present normally on our skin, but when it goes inside of the follicle, it causes the conversion of the sebum into fatty acids. These fatty acids elicit an immune response from the body, meaning that the body sends its white blood cells to the follicle where it releases certain chemicals and causes an inflammatory reaction. The follicle can eventually rupture, releasing its contents into the dermis. This is the start of inflammatory acne, which is characterized by the development of papules, which are small red or skin-colored bumps on the skin, or pustules, which are pus-filled pimples, and eventually nodules, which are just larger pimples, more than 1 centimeter in size, or cysts, which are present underneath the skin. So sometimes you'll see patients who say that they feel a mass under the skin, even though you can't see it on the surface, so that is a cyst. The problem with the nodules and cysts in particular is that when they rupture, they lead to scarring. And scarring is much more difficult to treat than acne. In addition, if you are a person of skin of color, you have a higher chance of having hyper or hypopigmentation. Alright, so now that we know how acne develops, let's talk about how we can prevent and treat it. Since the average duration of acne is 7 years, it's important to take measures to treat it. Too often, we jump straight to medications, but I want to talk about lifestyle changes first. The first change you can make is diet. So whether you're a gymaholic who's consuming whey protein shakes with each of your workouts, or you are on a pizza and cola diet, you need to stop right now. Here is a list of foods that has been proven to aggravate acne. These include refined carbohydrates, high glycemic index foods, which include sweets, ice creams, nuts, chocolates, cocoa, alcohol, dairy products, oily foods, and fizzy drinks. The best foods are probiotic-rich foods, fruits and veggies, and high-fiber foods. Stress also makes everything worse. Have you ever noticed that right before an important meeting or a big exam, you suddenly get a flare of new breakouts? The second important lifestyle change to make is to reduce your stress. Now, this is easier said than done, but there are certain ways that we can reduce stress, such as taking walks, meditating, and journaling. The third factor is smoking. So no matter how cool you may think that you look while smoking, stopping smoking is one of the best things you can do to prevent acne and also to stay alive. Poor sleep has also been associated with an increase in acne, mostly due to an increase in the level of the stress hormones. Finally, an increased BMI or increased weight has also been associated with increased acne. So if we can incorporate these 4 lifestyle changes into our routine, it will have a great beneficial effect for your acne. So number 1, get a healthy diet, have a proper night's sleep, stop smoking, do stress relieving activities. Okay, so you've tried the lifestyle medications, but you are still developing acne. Let's talk about some over-the-counter options that are available. I'm going to tell you some key ingredients that you can look out for in the products that you are buying. The first is salicylic acid. This is a beta-hydroxy acid which works by dissolving sebum and softening keratin. Now let's understand this with an analogy. Now imagine that your hair follicle is like a small garden hose, and inside this garden hose there are leaves that are getting trapped. Now these leaves are dead skin cells. In addition, there is mud that is going into the garden hose. Now the leaves and the mud, it all combines to block the garden hose, and in turn it prevents the free flow of water through the garden hose. What happens is that the water accumulates and eventually this would be the acne that develops. Now salicylic acid, what you can think of it is that first of all, it acts as a rake which gets rid of the leaves, and secondly, it acts as a detergent which dissolves the mud. So in effect, it will clear the pathway for the free flow of the water, or in the case of acne, sebum. The second chemical is benzyl peroxide. This works in 3 different ways. First of all, it exfoliates or gets rid of the excess dead skin cells. Secondly, it kills the Corynebacterium acnes bacteria on the skin. And thirdly, it greatly reduces inflammation. It's a popular ingredient for spot treatment, and especially in the concentrations of 2.5 to 5%. The other products that you can look out for are the alpha hydroxy acids, which includes glycolic acid, lactic acid, and mandelic acid. These gently exfoliate and unclog pores. The next group of medications is the azelaic acid, and this is both anti-inflammatory and unclogs the pores. Finally, we have niacinamide, which has both anti-inflammatory and reduces oil production. Okay, now we come to one of the greatest group of drugs that has ever been created, not only in the realm of skincare, but as a medicine as a whole. I'm talking about retinoids. Retinoids are vitamin A derived chemicals that have a range of effects that we want. For example, they are anti-pigmentary, anti-aging, anti-cancer. But for the purposes of this video, we will focus on its anti-acne effects. Now, retinoids, they basically act on every step of the acne formation pathway that we discussed earlier. They are available in the over-the-counter options as retinol esters, retinols, retinaldehydes, and adapalene. Now, I would recommend that you start with an over-the-counter form of retinoid when you are starting off, as it will help you to get used to the retinoids, and even though these are weaker when it comes to their therapeutic value, but they also have a smaller chance of causing an adverse reaction like dryness and peeling of the skin. The most popular retinoids include Neutrogena and Differin. If you are in Pakistan, I would recommend Adapco and Clear Gel. Now, before moving further, I want to reiterate that none of this is medical advice and this is for educational purposes only. Always consult your doctor before starting any prescription medication. So if you have acne, even after making the lifestyle changes and using the over-the-counter medications, then it might be time to see your doctor and get a prescription medication. Here are the most frequently prescribed medications. We usually start off with creams, which consist of topical antibiotics such as clindamycin. Clindamycin targets the Corynebacterium acnes bacteria. You can combine it with benzoyl peroxide for even better results. Secondly, we have stronger retinoids like T-retinoin and tazarotene, which are more potent but come with higher side effects. Use them on alternate nights to start off with. If you're still not improving with topical treatments, we start oral medications. These are much more effective at getting rid of acne. Now, if topical clindamycin is like a security guard at the front of the building, then oral doxycycline is like sending a SWAT team in to go and get rid of the target. It works amazingly well to decrease the acne over a large surface area. The only drawback is that the results last while you are taking medication, and the longest we usually prescribe doxycycline is about 3 months. Other oral antibiotics that we use are azithromycin and, in more severe cases, trimethoprim sulfamethoxazole. If you are still not improving or are an obese young female with signs of increased androgen hormones such as hair all over the body or irregular menstrual cycles, you may benefit from hormonal treatments. There are 2 common medications that we use. The first is spironolactone, which blocks the androgen receptors on the oil glands, preventing the release of excess sebum. The second is estrogen-containing oral contraceptive pills, which work by blocking the androgen receptors on the sebaceous glands and preventing excess sebum production. This has to be given for at least 6 months to 12 months. Side effects can include weight gain and clots in the leg. Now, if you don't improve with any of the above treatments, then it's time to bring out the gold standard, the treatment to end all acne treatments. I'm talking about oral isotretinoin. This powerful medication reduces acne severity for life. Whereas doxycycline is great for reducing remission at the start of acne, isotretinoin works to permanently reduce the amount of acne that the person has. We use this only in extreme cases due to the large amount of side effects that have been associated with these drugs, such as deranged liver profile and high cholesterol levels. While taking isotretinoin, it is very important to get regular blood tests done to make sure that it's not affecting your body adversely. In addition, isotretinoin is extremely dangerous for women, meaning that if a person is taking isotretinoin and conceives, the baby can be born with severe defects such as missing limbs. Women of childbearing age require a pregnancy test 2 weeks prior to starting isotretinoin and have to wait for at least 1 menstrual cycle after stopping the drug before getting pregnant. Now, here are some specific regimens depending on the type of acne that you have. So if you have mild comedomal acne with whiteheads, blackheads, and mildly oily skin, then I'd recommend a salicylic acid cleanser in the morning and a topical over-the-counter retinoid at night. Also keep a benzoyl peroxide handy for spot treatment. If you have persistent acne or slightly scarring acne, then you should go see your dermatologist. They'll probably advise you a prescription topical antibiotic like clindamycin, topical retinoid cream at night like adapalene or T-retinoin. If you have severe cystic or scarring acne, then you definitely need to go see your dermatologist. They'll probably start you on some oral medication at this point. So whether it's a short course of oral antibiotics like doxycycline or hormonal treatment like spironolactone, or depending on the severity, if it's severe enough, they might start you on oral isotretinoin from the beginning. and see your dermatologist early on in the stage, because acne is so much easier to treat than the scarring, which cannot be treated by any oral or topical medication and usually requires expensive procedures. There you have it, the ultimate guide to acne treatments. I tried my best to be as comprehensive as possible, but in case you still have any questions, feel free to leave them in the comment section below and I'll try my best to answer them. Remember, clear skin is possible and I'm here to help you every step of the way. If you found this video helpful, please give it a thumbs up and subscribe for more skincare related content. Until next time,